hygiene, gathered my material, introduced myself to the patient, explained the procedure, provided privacy, and raised the bed to a working height. So the material that we need for a nasogastric suctioning is a towel, a basin, water for the patient, the tubing, a NG strip, a pH test strip, a collecting bin, and a syringe, along with a lubricant, a alcohol prep pad, and a nasal anesthetic swab. So to begin the procedure, we'll apply gloves. And I will begin to get the area prepped. So I will take the alcohol prep pad and clean the area, and then apply the nasal anesthetic. Next, you will remove the NG tubing and measure out the desired length. To do so, you grab the end, measure from their nose to their ear, hold it, and then go from their ear to their stomach, which will yield about 55 to 60 centimeters. Next, you will grab some lubricant and lube about the first 4 inches of the tubing. Next, you will insert it into their nasal cavity, and once it gets into the pharynx, you will have them start drinking, as it helps to bring the tubing down, and they will tilt their head forward to prevent it from going into the trachea. Once you have reached your desired distance, which was predetermined, you grab the NG strip and place it over their nose and connect the tubing around it as well. You will now take the end and attach the syringe and pull out the full syringe. You will then disconnect it and pour it into the graduated cylinder and take out a pH test strip. You will dip the color side of the test strip into the solution, and you will compare it to the pH, which should be in the lower end of the acids. After you have tested the pH of the stomach acid, which should be 1 to 4 on the pH scale, you will grab the suction tubing from the wall and apply to the tubing for constant drainage. You will then turn it on and while it's running, it'll suction out stomach acid from the patient. And the best way to ensure that the NG tube is in the stomach is by a chest x-ray, but you can also take the lungs to ensure that it did not end up in the trachea, and then the bowels to ensure that it did get down to the stomach.